Hi guys, welcome to the class on alpha adrenergic antagonist. So these are the drugs which will going to block the alpha mediated activity. So they block alpha receptors. So you can classify alpha adrenergic antagonist into non-selective alpha blockers which blocks both alpha 1 as well as alpha 2. And there are selective alpha blockers which can block selectively either the alpha 1 or the alpha 2. So before going to that, let us understand the actions mediated by the alpha 1. So alpha 1, as you know, it is present in the vascular smooth muscles. Activation of alpha 1 will lead to increase in the smooth muscle contraction in the blood vessels, leading to increase in the blood pressure. Alpha 2 activation leads to decrease in the sympathetic outflow from the presynaptic nerve terminals, thereby the noradrenaline release will be decreased. So thereby the effect of blood pressure will be decreased. So basically the alpha 2 will going to control the sympathetic activity. So in other words, alpha 1 activation will lead to increase in the blood pressure, whereas activation of alpha 2 will lead to decrease in the blood pressure. So coming to the non-selective alpha blockers which blocks both alpha 1 as well as alpha 2 equally. So under this we have a drug called phenoxybenzamine which is a irreversible alpha blocker. It is a irreversible non-selective alpha blocker which is used to prevent the catecholaminergic crisis during the pheochromocytoma surgeries or pheochromocytoma removals. So why you need to give a alpha blocker before administering a beta blocker? So if you give a beta blocker alone, what happens means there is a unopposed action mediated by the alpha receptors leading to the vasoconstriction which will going to aggravate the catecholamine crisis. So that means there will be increase in the blood pressure and there can be a severe hypertension. So there is one more drug, phentolamine, which is a reversible non-selective alpha blockers which is used in the treatment of hypertensive crisis due to tyramine intake in patients who are on MAHO inhibitor. So usually if the patient consumes tyramine containing foods like cheese, meat and alcohol, in such conditions who are on MAHO inhibitor, there will be tyramine levels will going to increase, and what happens, tyramine being a indirect acting sympathomimetic agent, it will going to increase the blood pressure. So adverse effect of this non-selective alpha blocker is reflex tachycardia which will going to increase the heart rate. So coming to the alpha blocker with alpha 1 selectivity, so which has got more affinity towards alpha 1 blocking compared to the alpha 2. So under this we have a prazosin, terazosin and doxazosine, trimazosine, alfluzosine and tamsulosin and sildosin. So these drugs are used in increasing the urine flow by relaxing the sphincter. So especially it will be useful in case of benign prostate hyperplasia where there will be difficulty in passing the urine due to the urinary retention. And also prazosin is useful in post-traumatic stress disorders. So coming to the alpha blocker with alpha 2 selectivity. So this drug has got higher affinity to alpha 2 compared to the alpha 1. So here we have a mirtazapine which is a alpha 2 selective blocker and it is used as a antidepressants.